Fellowship here at Kaiser is great in that it prepares you for a career going forward, pretty much in any avenue of pediatric hospital medicine.
Our fellowship offers many different opportunities for fellows. These include medical education, leadership, research, and many different clinical opportunities.
One of the things that's unique about Kaiser Permanente is that it's an integrated model. It's a tertiary care center, so our patient population is very diverse. And as a hospital medicine fellow, you're very accustomed to taking care of a wide variety of patients.
The fellows get to work with all of the faculty directly. They get to also work with the subspecialist and the surgeons directly. That gives our fellows the opportunity to learn procedures from the subspecialist, learn advanced clinical skills from them.
Kaiser Permanente Oakland Medical Center is a fantastic place to do a fellowship program. I am a graduated fellow of this program, and one of the things that I find very valuable for our fellows is the diversity in education. We have conferences both locally, pediatric grand rounds, hospital-wide grand rounds. We have morbidity and mortality conferences. We have regional conferences in pediatric hospital medicine for hospitalists all across the region that our fellows participate in. Our fellows also do 3-center didactic series with other programs in the area that focus on fellow-centric learning.
The teaching environment is very supportive and very collaborative. It's family center rounds, we have medical students, we have interns, we have residents, the fellow, our subspecialists and our attendings are at rounds as well.
The Department of Research is a really key group of people that help you get your research project done in the very short span of 2 years. And we also have access to statisticians, librarians, basically anything that you could need to get your project done in this kind of shorter period of time.
There's really no other fellowship program in pediatrics at Kaiser, so you are the fellow. That means you are the first person to interact with the hospitalist, the cardiologist, the intensivist. In addition to that, you're not competing with other people necessarily for procedures, so you're sort of first in line to get some of those procedures. I think that can be really challenging at other hospitals and really great here. And then you also get to be with those people and getting that firsthand experience and knowledge from them.
The fellows rotate through our NICU and they gain skills in managing complex micropreemie skills, and then they also get to rotate through the PICU where they get to advance their critical care skills. They learn how to sedate patients in a controlled environment, and then they also get to work with their pediatric anesthesiologists in the operating room to advance their procedural skills.
I think transport medicine is very important. There's 2 aspects: taking those phone calls and then going to pick up the kids and taking care of them in the ambulance. And our fellows get to do both of that. And I think in going and picking up these kids, they learn a lot, and it makes them even better doctors when they take those phone calls and they can predict the needs of those kids.
The MPH track within the Pediatric Hospital Medicine Fellowship is super unique. Very few other places offer something like it. It's an 11-month interdisciplinary program at UC Berkeley, where you'll be with other healthcare professionals getting your master's degree, and it's fully funded by the program.
If you'd like to work in a big organization like Kaiser, it prepares you for that, but it also prepares you to do research in a large research institution or work in a public health sector, as well as go into a teaching hospital and teach residents and other fellows as well.
I would recommend our fellowship program here at Kaiser Permanente because of the close guidance that they get from our core faculty, the unique experiences afforded to them through both in the clinical space as well as the opportunity to pursue a second degree, whether it's through a master's in public health track or to get experience and education within research or within medical education. And really the fact that our fellows get a choice of 3 different tracks of where they want to focus their time during their fellowship.
And I just love the people that I work with, and it's just a great environment. I'm just really happy to be here.